By current published standards, I recovered a few days ago, and in fact, I tested negative today, but I still have to be a little careful. I can't work or exercise as much as I did before the infection. I think it'll still take some time to be fully recovered. But yes, nearly everyone I know has been infected. Some had asymptomatic infections like my daughter. Others have struggled quite a bit more, probably technically still mild, but if so, then a very spicy mild, to say the least. My experience was not too bad, a few unpleasant nights, but I consider myself rather lucky. But one of the funny things is I still find myself flinching in public when someone coughs. And now everyone is coughing. So old habits die hard. And that's a good thing, I think. Dying hard is certainly a good habit these days. And a city of coughers is better than a city of coffins. Exiting zero COVID in a country this large and diverse was always going to be tricky. I think many of us thought that the goal might be to reach next March, and perhaps it was, but we fell short. Consequently, many people are stunned by how quickly the surge came as the controls dropped. But as my son pointed out, what this shows you is how much the controls were still working, holding back this massive dam burst. But that simply couldn't be continued anymore. And this is because everyone else in the world had quit, and the social, economic, and political costs were no longer sustainable for continuing alone. Finally, I think the government figured we might be able to wear the worst of this up to or including Chinese New Year, thereby minimizing the overall negative impact on schools and the economy, perhaps being through the worst of it before the two sessions. And then perhaps we might see politically new policy supports that could be implemented to help aid the recovery. I've heard this criticism from some of my colleagues who frankly are still unhappy with the lockdown Shanghai encountered early this year. In fact, we were trending towards a more open policy before that happened. So that lockdown took many by surprise. But the real reason many thought we'd open up sooner is because few thought China had the ability to hold the line much longer. And in fact, China did have the ability to do so. So the question is, what did the rest of the year buy us? And in short, it bought us time. Time to better prepare some vulnerable people, but also it bought vulnerable people more time to live because, many will now die. I think it also bought the government more time to understand that it had reached the end of its ability to fight and that it had done all that it could to minimize losses of life. From an ethical perspective, you don't just end these kind of efforts until they're exhausted. You don't just say, okay, we're tired of saving lives. We can still do it, but we're going to stop now. Instead, you fight until the end. And if that end comes in December, then that's what you get. Well, some Western media and Western leaders have always politicized the pandemic, often in racist ways. And not just the pandemic, of course. There's been a constant drumbeat of demonizing discourse from the West against China, primarily the United States. Of course, there's also always a double standard at work. So on the one hand, let's not be surprised when the US says these things, and let's not get distracted by them. It's just idiot speech that aims to hurt your image and feelings. On the other hand, the exit certainly outpaced expectations. I wouldn't say that anyone should have been caught flat-footed, but many were. I think so many were now used to central authorities telling them what to do. They were kind of unprepared to deal with matters when they accelerated so quickly. So in fact, we probably could have done a better job, perhaps with the first few days of the exit. But even if we'd done so, I'm not sure it really would have changed things. In fact, it might have made things worse with even more panic buying and poor decision-making at the local levels. Countries like the US categorically failed in their control efforts. And these alone had massive negative impacts on the economy and social well-being. And since it's been trying to recover and rebalance, and generally at others' expense, as we're seeing with the US Federal Reserve now, papering over failed US policies and externalizing these costs globally. Now, in China, we talk about balancing because the controls were so strong and effective. We've seen a number of efforts to stimulate local growth in cities that play outsized roles in China's economy. But I haven't yet seen data indicating that efforts to support small businesses, for example, have been very effective. A lot of these have been lost, closed down, the lease is broken, and so on, and they can't just reappear quickly. But we know that they have been playing a major role in the Chinese economy over the last few decades. And we know that they're very important, especially for women. But, in short, China has paid considerable attention to the economic side. But the fact is these efforts were always being undercut by the controls. Now, perhaps we'll see more traction now that the controls have dropped. The big concern, however, is that the world is now facing a serious risk of global recession. And if it takes several months for China to stabilize post-zero COVID, and then China encounters a global recession, we might be looking at a tough year economically. In fact, I have been working at ECNU since 2010. I went back to visit family in December of 2019 and then got trapped in the United States for 2 years given the travel restrictions. And I got to see really the worst of it in the US, the food lines, the people dying, 5 of my friends dying from COVID. So there really is no basis of comparison. The US approach was almost completely the opposite of what we see in China. The US is deeply fragmented and polarized, with systemic failures in governance stretching back decades. Its Achilles heel has long been its health system and the general health of its population, as well as a national governmental system that was designed by the founding fathers to be weak and ineffectual, except in foreign affairs. But if we look at this from another perspective, the US saw at least 1.1 million deaths, a figure that some experts believe represents a 15 to 20% undercount. Now, current studies indicate that those who died lost 10 years of life on average. In public health, we call those YLLs, or years of life lost. And when we do so, we look at aggregates. The US lost more than 10 million years of life. Now, in China today, not even the worst estimates predict that we'll reach anything as proportionally as bad as that. But if we hadn't had effective controls, some estimates indicate that China might have lost more than 10 million people. And that would have amounted possibly to more than 100 million YLLs. So without a doubt, we know that exiting zero COVID is now producing more deaths from the disease. But overall, the numbers will be as low as they can possibly be. And we know that many who die now would have died before, and many who will be saved now will remain saved. So in the aggregate, what we can say is that tens of millions of years of life were saved, perhaps 100 million. And in these respects alone, the policy was an astonishing success, a fact that will not change regardless of whatever happens next.